Great, thank you, Darcy. And anybody on the webinar, if at any time you have trouble hearing me or have trouble viewing your screen, please type a note into the chat window so one of the moderators can get a hold of me and we'll sort out and fix whatever the problem is. But during the first half of today's webinar, for my presentation, I'll be talking about how public health surveillance can be used to monitor for and detect drinking water contamination incidents, and talk a little bit about how water utilities can tap into that resource. So I'd like to start with a case study to demonstrate this. And this is built around a waterborne disease outbreak that took place in 1993 in Gideon, Missouri, population 1,100. So it started on November 10th when the water utility flushed their entire water distribution system by sequentially opening the 50 fire hydrants located throughout their system. And this was the most extensive flushing operation that had been performed in 3 years. Later, near the end of that month, the Public Health Department identified 7 culture-confirmed cases of Salmonella typhimurium gastroenteritis, which were reported to the Missouri Department of Health. And this, of course, triggered an epidemiological investigation. Throughout December, the number of cases continued to rise, and the health department continued their investigation and eventually ruled out foodborne illness as a potential cause. And at that point, the only commonality they could identify is that everyone who developed the illness had been drinking from Gideon's water supply. Then, on December 16th, the water utility, doing their routine coliform testing, did get positive hits for both total and fecal coliforms. And this combination of both public health data and environmental data implicated contaminated drinking water as the cause of the outbreak. Thus, a day later, they issued a boil water notice. And a subsequent investigation revealed that there was compromised storage tanks with birds roosting in them and defecating into the tank. And that was presumed to be the source of the salmonella that infected the residents of Gideon. And the point I want to leave you with this example is that in this case, as in many other waterborne disease outbreaks, first evidence the really compelling evidence that we uncover are people getting sick or public health data. Unfortunately, in this case, there was a pretty big gap between the initial cases detected and the additional evidence necessary to tie this incident to contaminated drinking water. But we do have the tools to narrow that time frame substantially and thus do a better job of protecting public health. And in addition to this incident in Gideon, there have been many other disease outbreaks that were first detected through public health indicators as shown in this table. And the column on the right-hand side shows the different kinds of public health entities that were involved in detecting these outbreaks. And some of these incidents are probably familiar to most of you, like Milwaukee and Alamosa. But there are some that are less well known, such as the 2004 waterborne outbreak of giardiasis in Bergen, Norway. And in fact, in a review of about 300 drinking water contamination incidents, we found that over 90% were first detected through public health signals. And this demonstrates that public health surveillance can be a powerful tool to provide an early sign of possible water contamination. So just to make sure we're all speaking the same language, same terminology, the way we're defining public health surveillance here is that it's simply the collection and analysis of public health data in an attempt to detect early signs of disease in the community and to detect them early enough so that there's an opportunity for intervention to reduce consequences. So this is a prospective activity. It is trying to detect things early enough to make a difference, as opposed to retrospective analyses that look to figure out what the cause of an outbreak was after the fact. And some of you might be familiar with one of the most common applications of public health surveillance, and that is to monitor the flu season to determine when its onset, severity, and duration are. But we know that public health surveillance does have the potential to be used to monitor for many other kinds of disease outbreaks, including a waterborne disease outbreak. So public health surveillance works by monitoring for early indicators of disease. And these indicators relate to actions that sick people take to address their condition, what we refer to as a healthcare seeking behavior. And I think we all are familiar with this concept the decision-making process that goes about when we start to feel sick. If it's a minor illness that we're familiar with, we'll probably self-medicate. On the other hand, if it's something very severe, very sudden, very unusual, we may seek more urgent health care. And while the tolerance for illness varies across the population, when you look at all of it aggregated across the population, you can see some trends that are useful. So the kinds of public health or health-seeking behaviors that can be monitored include purchasing over-the-counter medications, calling health advice hotlines like nurse hotlines, calling poison control centers, especially if you think you or a family member or friend has been exposed to a poison or a toxin. If you're sick and you don't get better, you may schedule an appointment with your primary care physician. If it's a serious condition, you might call 911. They may send an emergency medical service, an ambulance, to both treat and transport you to the emergency department for proper treatment. So again, all of these activities can generate signals that can become digitized and thus are fodder for syndromic surveillance. So, and speaking of which, there are two kinds of public health surveillance that are commonly practiced. One we refer to as case-based surveillance, and the other one is syndromic surveillance. And over the next two slides, I'll explain what we mean by each of those terms. So case-based surveillance is performed by the healthcare professionals like physicians and nurses, and is performed during routine patient exams. So these examinations can lead to identification of individual cases of specific disease conditions. And some of these diseases are legally required to be reported to the state health department. And some examples that are relevant to drinking water include cholera, cryptosporidiosis, giardiasis, and legionellosis. One thing to note about these reportable diseases is the time frame in which healthcare providers are required to report the conditions to the health department varies depending on the disease. And it can range from a requirement for immediate reporting up to a 5-day delay to when the condition needs to be reported. So if you look at this, it's probably a stretch or at least unlikely to think that an individual healthcare provider might notice an outbreak. But if all of the healthcare providers are notifying a state or city or county health department of these unusual cases, that health department can aggregate that data and maybe recognize broader trends in the community that might be the first signs of an emerging disease outbreak. So on the other hand, syndromic surveillance involves monitoring of aggregated public health signals, again, in the attempt to detect early signs of illness or poisoning. And in this case, syndromic surveillance tools are used to analyze the data and detect anomalies, or, spikes in the monitored data stream that might indicate that a disease outbreak is starting. And typically, this type of surveillance monitors data from health-seeking behaviors that are available well in advance of clinical diagnosis or the results of testing of human samples like blood or urine samples or stool samples to look for specific causative agents. So syndromic surveillance may be much more timely than a case-based surveillance approach or the traditional practice of just relying upon reportable disease reporting to detect outbreaks. But syndromic surveillance generally provides fewer case details, very scant details, in fact, compared to case-based surveillance, which has detailed and informed information about the cases that underlie the signal. So each of these approaches, case-based and syndromic surveillance, has its strengths and weaknesses, but when they're used in concert, they can truly complement one another. The syndromic surveillance may give you the earlier signal because it's relying upon health-seeking behaviors that occur very early and are much easier to obtain and analyze in aggregate. Whereas the case-based surveillance will provide the details that may be necessary to have, confidence that you really do have an outbreak emerging. So syndromic surveillance is generally performed by automated statistical software, and examples of systems that are in use include Epicenter, which was developed by Health Monitoring Systems, and the National Syndromic Surveillance Program, which was developed by the Centers for Disease Control and Prevention and operates around the BioSense surveillance platform. So one final note is that so these tools are in use across the nation, but the specific surveillance capabilities of any one public health jurisdiction, they can vary widely from jurisdiction to jurisdiction. So it's most useful to find out what the health departments in your areas are doing in terms of surveillance to see if you can tap into those. So as noted, public health surveillance is typically performed by health departments at the local, city, county, state health level, and also by poison control centers, and we'll say more about that in a moment. And frontline healthcare providers are involved in this process as well, but their role is typically as they're involved in generating the data that feeds the surveillance systems that are monitored by the health department or the poison control center. So the point is that if you want to tap into public health surveillance to monitor for water contamination incidents, you need to form partnerships with the health department and the poison control center. Which brings us to our second poll question of the afternoon or morning, depending on where you're at. So with this question, we'd like you to tell us which public health partners you or someone at your utility has formed a relationship with. And that relationship can list, at any level, an informal agreement, sharing of contact information, all the way up to something that's more formalized and documented. And what we see, let me see, sorry. And these relationships can be formulated in many ways. It's often useful to have a common goal or purpose or, maybe project around which to cement the relationship. For example, maybe monitoring for lead exposures or trying to get a handle on Legionella occurrence can all be sort of anchors around which to build the relationship between a water utility and a health department. So Emily, how's the poll going? Should we leave it open or can we close it out?
I just shared the results. You should be able to see them now.
All right, great. Let me expand that a little bit so I can see it. All right, well, this is encouraging. So we see a lot of you do have, 2/3 of the respondents indicate they have a strong relationship with their local health departments, and many also have relationships with their state health departments. So that's good. The Poison Control Center had the fewest relationships with, and that's consistent with what we've seen. But I would advocate for reaching out to your poison control center if you haven't done so, because they can be a tremendous source of expertise on a variety of chemicals and chemical exposure information. So the health departments, again, are key players in conducting surveillance, and their main responsibility is one of their main responsibilities is to monitor the health of the communities they serve. And again, they can do this by collecting collecting and analyzing. Sorry, I went too far. Okay, let's go. By collecting and analyzing public health data. And to do this, again, they use syndromic surveillance systems like Essence and BioSense. And again, the purpose is to try to identify community-wide trends that might suggest a possible public health incident so that they can take steps to mitigate or control the public health incident and deal with the situation. So poison control centers also conduct surveillance. And for those unfamiliar with poison control centers, these are regionalized centers. There are 55 in the United States, and they're operated 24/7 every day of the year. And they're typically used to field questions from the public or from healthcare providers, like treating physicians who are dealing with or treating patients that have been exposed to toxic substances. And in the context of public health surveillance, toxicologists handle calls, again, from the public or healthcare providers to answer questions about potential exposures to poisons. As calls come in to the poison center, the staff are continuously evaluating the cumulative call record and looking for unusual calls or clusters of similar calls. So they may be able to recognize an emerging outbreak or spike in illness due to exposures to a toxic substance. Also, the calls and information that poison control centers collect are uploaded to the National Poison Data System in near real time. And this is advantageous in that it provides us with a means to conduct surveillance at a variety of geospatial levels, all the way from a local level up to a national scale, to look for, again, unusual trends in exposures to toxins. And due to the variety of calls they field and the variety of substances that they're trained in, they do have the ability to detect incidents that might be due to exposure to chemicals, including toxic industrial chemicals, radiochemicals, and biotoxins. So throughout this presentation, it's apparent that the public health surveillance is performed by public health agencies, poison control centers, and their partners. But if a water utility wants to tap into that ongoing surveillance for the purpose of monitoring for possible water contamination, they do have a role to play as well. Specifically, one of the first steps is to establish the partnership with the public health sector, most notably the local or state health departments and poison control centers. Once they've done this, they can work with those public health partners to identify and understand the public health surveillance that is in place in the jurisdiction in which the water utility operates. And then it's important, though, also to assess whether or not these surveillance systems, as currently set up, are going to be useful to monitor for possible water contamination. And some examples of how that's important are, first, with respect to timeliness. We know with a water contamination incident, we have a relatively small window to respond to reduce the chance of exposures. Maybe, in some cases it's less than 24 hours, but no more than a couple of days, after which a do not use notice or a boil water notice becomes maybe like closing the barn door after the horse has left. Also, the surveillance may be set up in a way that it looks for contaminants or conditions that are not relevant to water, but it may be possible to add disease definitions, or what we call case definitions, to these surveillance systems that are specific to specific types of waterborne diseases, those of interest. And finally, a water utility can work with their health partners to develop a procedure to investigate public health surveillance alerts that could be related to a problem with drinking water quality. And with that, let me go ahead and open up another polling question. And with this one, we'd like to see, this is simple yes, no, we'd like to see if you or someone at your utility has worked with its public health partners to develop a planned response to a drinking water contamination incident. And I would offer that minimally this involves exchanging contact information, ideally 24/7 contact information, and conditions or circumstances under which each entity is going to notify the other about a possible water quality problem, or a public health signal that could, could implicate contaminated drinking water. But beyond that, you could take it further to really hone the roles and responsibilities in this, unique situation of a water contamination incident, as well as documenting how the environmental data the water utility collects is combined with the public health data to make informed determinations about whether or not there is a problem with the drinking water. And from the poll, again, we see we've got a proactive group of participants today. That 61% of the respondents indicated that they have already worked with their health partners to develop a plan for responding to a water contamination incident. So you're in good shape. So in summary, there are many good reasons and important reasons for utilities to form collaborative partnerships with their health departments and poison control centers. The first is simply increasing an understanding of each other's capabilities, expertise, and resources, as well as the authorities that, for example, the health departments have, and the responsibilities that the utility has during a water contamination incident. Furthermore, an active relationship with public health partners would enable more efficient and coordinated communication during a possible contamination incident. And the shared responsibility and joint decision-making during an investigation of possible water contamination would serve to increase confidence in the decisions and response actions made during that situation. And finally, many public health professionals have knowledge and resources about contaminants and their potential health effects. And these resources can help identify or characterize potential contaminants, and they may inform some response decisions. And one good example is public health partners may be able to obtain or vet information about health effects and thresholds from toxicological studies that can be used to determine a safe or acceptable concentration of a contaminant in drinking water. So just to wrap up, during this presentation, I provided a general overview of public health surveillance and how it could be applied to monitor for water contamination incidents. And if you're interested in this topic and want more guidance, you can go to the link provided on this slide and download a guidance document on the topic. And again, you'll have copies of these slides, so the URLs for all links in this presentation will be available to you. And with that, I'll turn it over to Jonathan Yoder, and let me go ahead and give you mouse control. All right, Jonathan, you should have mouse control now.
Great, thank you, Steve. And sorry, we were going ahead. So thank you, Steve. A lot of my time is working on the other end of this partnership. We're encouraging local and state health departments to reach across to their water utilities. So I really appreciate the opportunity to talk about this with you all. So I don't need to tell you that water-related emergencies and outbreaks can be really challenging, and part of that is just because there are multiple contamination sources. You can have pathogens, chemicals, toxins, some of which are unregulated. They could be organisms that live in biofilms. They can be toxins. They can be chemicals, and some of the infrastructure challenges come in here, where we have an aging infrastructure, both in buildings and in water distribution systems, and it's taking place in the context of a changing climate, where we may experience more or larger natural disasters, challenges with increased temperature, and intermittent droughts and floods. And during emergencies, it's important to remember that multiple other critical community infrastructure is impacted by water. Water is one of the very, very important pieces of a community. One of the most important public health interventions is safe water. And when that's not available, or intermittently available, it impacts other systems. And as an example, here's a graph from the National Infrastructure Advisory Council on water sector resilience report. And they talk about that all water users experience degraded capabilities after 8 hours without water. So even if they have electricity generated on site, the lack of water really impacts their ability in an emergency situation. And particularly that's noted in healthcare facilities, which can be degraded by 2/3 or even almost completely degraded just within 2 hours of loss of water service. So a critical piece of in emergencies is to have water. And not a surprise to you, but as I mentioned before, there are lots of challenges that to our water infrastructure. So that includes the treating water, distributing water, and they all have challenges with, or a number of them have challenges with their with delivering it safely, with having the ability to go without water main breaks, and even things like combined sewer overflows and sanitary sewer overflows are important. And from the public health side, your counterparts are also dealing with challenges in their capacity to have equivalent programs that deal with water. Steve provided a really good overview of how public health surveillance works, but the expertise to understand water systems is often not there at local, especially smaller local public health departments. And so in that context, setting that stage, I want to talk a little bit for a few minutes about how do we communicate during these disasters, knowing that they're complicated, knowing that they can occur anytime, and knowing that they can be caused by different organisms or different types of situations. How do we remain prepared to effectively and efficiently communicate to the public in the event of a water-related public health emergency? So the right message at the right time from the right person can save lives. And so I'll be going through the way CDC approaches crisis and emergency risk communication with some specific examples for water. We're going to talk about the principles and how to apply those principles to water-related public health emergencies, and how can we educate people about the safety of our water even in the absence of an emergency. So in the event of an emergency, people generally respond differently than they would normally take in information. So people who are affected by an emergency will take it in, process it, and act on it differently. And the 4 ways that people process information during a crisis is that they simplify messages, they hold on to current beliefs, and an example of the holding on to current beliefs was something I just saw in connection with the Hurricane Michael affecting the Gulf Coast, where a local utility had to respond to people who were going out buying bottled water and tell them, look, our water system is not dependent on a single treatment plant. We have well water, each of those is emergency generator supported, so we don't anticipate that water shortage is going to be a hallmark of this situation in our community. But people have this current belief that in a crisis you need to go buy bottled water. So in addition to that, we look for additional information and opinions, and that can be social media, TV. We try to look for consistent messaging. And finally, during a crisis, we tend to believe the first message. So it's important for credible organizations to be first. And risk perception equals hazard or the technical or scientific measure of risk plus outrage, which is the level of emotion that the risk evokes. So some types of risk are more acceptable to people than others, and the less acceptable the risk, generally the greater the outrage. And this can be something like a voluntary risk versus an imposed risk, something that's controlled by an individual or the community versus something outside of our control, a familiar risk versus an exotic risk, a risk that has natural origin versus a man-made risk. And what will the public ask first in a crisis? If it's enough to cause outrage, the public's risk perception is high. What do they want to know right off the bat? And it's these are the general questions. Are my family and I safe? What have you found that may affect me? What can I do to protect myself and my family? who caused this, and can you fix it? And generally it's in this order. And keep these questions in mind when you're developing a communication strategy during an emergency. And these are those 6 principles that I mentioned of crisis and emergency risk communication. Be first, be right, be credible, express empathy, promote action, and show respect. And so let's walk through them. So be first. If crises are time sensitive and communicating information quickly is almost always important. For members of the public, the first source of information often becomes a preferred source. So if the information is yours to provide by organizational authority, do it as soon as possible. Establish your organization. And that includes identifying the proper spokesman and preparing that person for that role. And that needs to be done in advance so that in the event of an emergency, they're ready to respond. And so you don't want to be like the pilot here on this cartoon, which is in the midst of a crisis looking for a risk communication specialist. And finally, being first helps ensure that you will lead the message. If another organization comes out with a message first that you don't agree with, you'll spend a lot of your time trying to correct that misinformation instead of spending that time actually getting the message out. And secondly, be right. When a crisis strikes, there's usually a lot of confusion and intense media interest. Information is usually incomplete and facts are sparse. And so it's important to be very accurate during that time period. So you may not know everything at the beginning, but you can and should give facts in increments and get the facts right. Tell people what you know and what you don't know, and telling them when you will know it and how you'll be getting that information out when you know it. Third, be credible. Tell the truth. Don't withhold information in an emergency situation. Uncertainty is worse. So people will lose confidence if you're giving information that's uncertain. Under promise and over deliver should be your goal. Guarantee only what can be delivered. And promising something that you can't really deliver, it can really undermine your trust. They'll ignore your health recommendations. They'll demand things that misallocate your resources. Public health policies will be circumvented, and it really, at the bottom line, it impedes your ability to protect the public. Express empathy. Crisis creates harm, and suffering should be acknowledged in words, ideally in the first 30 seconds of a message. Acknowledging what people are feeling and the challenges they face. And even if that risk to the public health is actually low, be aware of their risk perception, which might be high because of that outrage. And we have to give people the space and allow them the right to feel that fear. And this means not pretending they aren't afraid or telling them they shouldn't be afraid. But it also means not over reassuring them. Reassurance can backfire. Instead, we can agree that the situation is shattering, and being afraid is a natural reaction. Expressing empathy is like this throughout a crisis can build trust and reduce emotional trauma associated with crises. And then promote action. Help give people simple tasks to gain back a sense of control. Even those who do not need to take immediate action will be looking at recommendations and possibly vicariously rehearsing them. So if you give people step-by-step instructions during a crisis, it helps calm their anxiety and helps restore order. As we talked about earlier, people do not process information the same way during an emergency, so it's important to make the actions accessible and clearly understood. Some people may be more motivated than others, so you may suggest a range of responses. Here's what, at a minimum, you can do, and here's, if you really are concerned about this, here's a maximum response, and then something in the middle that's achievable. And show respect. Maybe this is obvious, but we don't always show respect in the way we communicate. So have respectful communication. People feel vulnerable and they need to be respected during a response. So here are some examples of this in action. And the first is a Shigella outbreak in Michigan, and it happened in the county of Genesee, which is also where the Flint water system resides. And so we're not going to go into the big picture of the Flint water challenges and the outbreak and the other water quality issues there in Flint. But following the big issues there was a outbreak of Shigella, which is a bacteria that is chlorine sensitive, so it can be clearly inactivated by chlorine. But because the health department was not trusted, because the water utility was not trusted, people were naturally suspicious that this Shigella outbreak came from the water supply. And so how do we respond there? And this is an example. There's certainly things that we could have done differently or better, but just to walk you through very briefly how we did respond and how we thought through these principles when we went there. So even though the health department had already started to alert the public via the news media, there's been a lot of speculation about the source of infection and blaming of community members for not using water to wash their hands. The community did not want to hear that it was unlikely that it was spreading through drinking water, even though that's where the data pointed. The initial data pointed that way. So we had to start with doing a lot of listening, meeting with key community leaders, working with the health department to understand what, and the community to understand what they wanted, how they wanted to be communicated, who they would listen to, and the state was not trusted. So it was important to have a trusted source that was independent of the state structure, and that we could listen and listen credibly, come with our independent assessment of the situation. And so we use these principles to develop the letters, the presentations, the talking points, the media outreach, and promoting action throughout the community to get this outbreak under control. And a second example is Naegleria fowleri at a treated U.S. drinking water system, and this was in St. Bernard Parish, Louisiana, a few years ago. Initially, this was the first time that had been detected in a treated drinking water system, and in that setting, in certain parts of the system, there was no detectable chlorine and higher water temperatures, which allowed Naegleria to colonize the drinking water system. So it took a while for the system to be able, after they recognized the issue, after the death, for them to raise the level of chlorine to a safe level. And obviously during that time period, it was important to have ongoing regular communication with the community. And so as we helped the state of Louisiana and the local community deal with that, it was important for us to be credible, sharing what we know, what we didn't know, because people were feeling that risk very, very at a very heightened sense, because this was water that they used to bathe their kids, this is water they drank, and it's important to tell people what they know, to correct the information as it appeared, provide a continuous open access to health officials so that we could answer questions and concerns and express our empathy and respect for their heightened concern about the safety of the water. And these are a few some tools that will be directly relevant to you as water professionals. So here's some principles that I think are applicable from EPA's effective and crisis communication during water security emergencies, that talk about a large proportion of the general public believes that water utilities frequently test for all possible contaminants. And so that at the beginning will have to be something that you talk about. Here's what we do, here's how we test, here's how we know the water is safe. Here are the things that will trigger us to know that there is a problem with our water. The questions from the public often focus on time, on how long it's going to take until the normal water service is restored and from getting safe water. And so it's important, you'll get the question about, is my water safe? It's important to know what you're going to say, because people want a yes or no answer, and sometimes it's not that simple. So telling them how you're going to get there, here's the steps that it'll take, here's how we can be sure that we have safe water and that we're protecting the community. And then finally, reestablishing the confidence in the water system after remediation may be challenging. So knowing that there may be a lag time before people really trust that water system again. And we've certainly seen this time and time again in communities impacted by water emergencies and contamination. So I want to wrap up with a couple resources that may be useful for you. This is our Drinking Water Advisory Communication Toolbox. This is something we've worked together with EPA, American Water Works Association, and other partners to put together to help public health departments and water utilities respond to drinking water advisories and other water emergencies. This is on our website. It includes how to prepare communication activities, their templates and tools, recommendations for follow-up actions and assessments. And it covers both pathogens and chemical and toxin contamination, extreme weather events, and we've recently updated it with some new and updated guidelines for audiences and water disinfection and flushing. And this is just an example of some of the templates there. And this is available on our CDC's water emergency website, and there's a link at the end of the presentation. And we have a number of other resources, but I think now we'll move to a poll that talks about what types of communications tools and products would be most useful to you to prepare for and respond to water emergencies. Thinking of knowing that you'll need to move quickly, to be first, to have resources available ahead of time. Well, these are a couple ideas. Would these be helpful, or are there others that would be helpful as well? On our website, our water emergency website, we have a number of other resources for natural disasters, for other types of emergencies, and encourage you to check that out, but also let us know if there are resources that would be helpful for you as you think of responding, particularly communication resources. And whenever that's done, we can move forward. It looks like there's a good many of you talked about prepared press releases, thinking of things that could be ready to go, social media tools, and lists of frequently asked questions. So I think all three of those would be, from the poll, would be very useful. And I think as we think through developing new ones, I think that's really the way we're trying to structure things, where there are accessible ones. Because I think right now you kind of have to dig down into our website to find them. And so I think maybe knowing that your audience would like those kind of resources, we'll try to make those more readily apparent when we redesign those tools. So thank you. So finishing up, just thinking about general communication. So not in an emergency situation, still important to talk about the water. And again, you see these kind of messages all the time. People talking about raw water, people talking about trying to get off the water grid. Which says that there's important work we still need to do to talk about water and what we're doing every day, what you're doing every day to make it safe. And I think to illustrate the challenges of, sorry, I missed a slide, but to illustrate the challenges, there was a recent, so I think it's important to talk about safe drinking water and the success of why safe drinking water plays a critical role in the success of a society, so that it meets the basic public health needs of providing safe drinking water, along with adequate sanitation and things like hand washing. The issues around dental health through fluoridation and supporting lots of other industries and critical community infrastructure. So the progress we've made have made our tap water in the country one of the safest drinking water supplies in the world. So water, and it's important to remind people what that actually means. Water that's treated to levels that get rid of harmful pathogens, and it's that we've made progress in the country in a large part because of improvements in safe water. So reinforce this. Encourage you to reinforce the importance of safe drinking water in community. Share what you do every day to ensure people have safe and healthy water. Speak up during awareness days and weeks that come out throughout the year. So think about ways to get that message out, so that people are looking at you as a credible source of health of information around safe water. And that they see you out there not only when there are crises, but every day talking about safe water. So thank you for the opportunity to talk. This certainly reflects a lot of work done by others and at CDC, but feel free to check out the resources that are available. Thank you.
Great, thank you, Jonathan. Really appreciate the presentation. Some great information there. And for any of our participants, if you do want more information, the resources Jonathan and I talked about during our presentations are available at these websites. So we'd encourage you to visit if you have some more questions or need some more information. And we're now get ready to roll into the Q&A session. So just a reminder, we're going to take all questions through the chat feature on the webinar. So that's the little, there's a little chat box off to the right. So type in your questions and we'll get to as many as we can in the remaining time. And but as you're starting to formulate questions or type them in, we'll also open up a final poll question. And this is sort of related to the poll question that Jonathan asked, but maybe in a broader broader sense. We're interested in knowing generally and broadly, what are the kinds of tools and products that EPA or CDC could develop to help water utilities improve their relationships or interactions with public health partners. And we list a couple options here, things that we've done in the past, like facilitated workshops, exercises. We do a lot of exercises, tabletops, and all the way up to full scale and functional, or primers and guidance and things like that. And if you have specific recommendations, we value those very much. So if that's the case, you can just click other, and in the chat box, type your suggestions so we have some more information to go on about the products that we could develop for the water sector. And again, we do take this very seriously. It is very helpful for us to hear from you. And given your responses to the poll questions, I know that the participants today are highly motivated and informed. So I think you're well situated to help us see what we need to do next to push this effort forward. So with that, I'll ask Darcy to facilitate the Q&A session for us. Darcy?
Sure. Yeah, and just a quick question. Would you like Emily to present the results of this poll?
Oh, sure. Yeah, let's pop them up. We got time.
Okay. All right. So the first question I think I'll direct at you, Steve. I think this is relevant to the material you covered. The question is, how do HIPAA regulations play into data sharing and availability of data? And actually, Jonathan might want to weigh in as well, now that I think about it.
Yeah, I'll start and ask Jonathan to elaborate. So for those who aren't familiar with the acronym, I think most of you probably are, it's the Health Insurance Portability and Accountability Act. And that one of the provisions of that act protects health information for individuals like you and me. So what that does with respect to public health surveillance is used for monitoring for drinking water contamination incidents is it puts really the burden on the health departments who do have access to the more detailed protected information that is protected under HIPAA, because there are provisions that allow that health data to be used for activities like syndromic surveillance, but only by designated agencies like health departments. So they can get the detailed information and do the surveillance. What they can communicate to the utility is, the aggregate information, like we're seeing a signal that reflects these kinds of syndromes. And we think that for that reason, maybe it's tied to drinking water. And I will point out we've had to deal with this one-on-one with a number of utilities working with their health partners. And there are ways where you can still protect patient information, but provide a little bit more detail, enough detail so the utility may know where to look. For example, if they're going to go out and do sampling and analysis to look for a pathogen, that the health department can at least narrow it down to maybe a pressure zone or a neighborhood where they can go out and collect samples. But they do have to stop short of sharing anything that could potentially be used to identify an individual patient. That just can't be shared. But there are workarounds, and if you're interested in that, I'd encourage you to sit down with your health department and talk through how you can get meaningful data without violating the HIPAA requirements. Jonathan, anything you want to add?
No, I think you did a really good job covering that. I think the key point is that we even public health agencies are subject to some of the privacy rules of HIPAA, but there are ways to use the data in ways that don't identify people and their particular health condition. And in emergencies, there are certainly a little bit of different rules, but you certainly still have to go by that and not violate the HIPAA rules, even in a public health setting.
Okay. The next question, Steve, or I guess there's a comment and then a question. It reads, we've been frustrated in efforts to obtain the blood lead levels which public health agencies routinely collect. This might be informative when correlated with areas with lead service lines. This might identify a correlation or lack of correlation. For some reason, they have not been responsive to our requests. We respect the privacy concerns and would not expect PII to address base data. I wonder if others have similar challenges or better cooperation from public health agencies. So it's more of a comment, but you might want to reflect on it.
Yeah, and full disclosure at first, other people in my office are working, and there are many of them working full time on the lead issue. And what I would propose, if the person who asked the question can send a private message with some contact information to the meeting organizers, I could put you in touch with the people who are working on the lead issue for EPA. This is something I know we've advocated for, the agency's advocated for sharing of this kind of information in some capacity. Again, of course, it must be done in a way that protects patient confidentiality, or in this case, the individual people with the lead test results being they can't be identified. But there would have to be, I think, based on our experience with public health surveillance, there would have to be a reasonable way to aggregate those lead blood test results and share them with the utilities. So this seems that it could be a tractable problem, one that we can maybe provide some suggestions on how to solve. But offhand, I don't know the specific way to do that. I'm hoping other colleagues in my office would, though.
All right. The next question is one of the participants would like the speakers to speak to the issue of GIS, geospatial data, and role requirements for assisting in emergency preparedness.
This is Jonathan, and I know one of the, I'm not sure exactly the context of the question, if there's a specific challenge with GIS. I know some of the issues around emergencies from a public health standpoint are that, I do hear sometimes from state health departments, local health departments, that the map layers that give the distribution systems are challenging to obtain. Meaning they don't quite have that map layer of the water distribution system, and I know there's security reasons for that. But I do think if there are ways, I'm just thinking of a possible solution, if there are ways that there can be memorandums of understanding or agreements that during an emergency, these kind of data can be shared. Map layers of critical infrastructure, so that a complete picture of a community in an emergency can be done. I think that would be really helpful to have that in place ahead of time, because I think in the moment that's sometimes really challenging to figure out how those data can be shared as it gets to spatial temporal understanding of an emergency.
Thank you, Jonathan. Steve, I don't see any further questions. I see some comments, but no other questions.
Okay. Well, that worked out pretty well. We're nearing the top of the hour. And I would encourage you, anybody on the call today, or on the webinar today, if you do think of additional questions that we didn't have a chance to, or if there are questions we didn't have a chance to discuss, you can reach out to Jonathan or myself at our email addresses or phone numbers listed here.